Amanda Fisher here with Empower Your Pelvis. Have you ever wondered what your pelvic floor physical therapy wants you to know before coming in for your first appointment of pelvic floor physical therapy? I'm here to tell you exactly what we want you to know. First thing being, your pelvic floor physical therapy internal pelvic floor muscle examination, so your internal exam where you're assessing the muscle tissue, assessing how these muscles should move, shouldn't be painful. You may have had an uncomfortable exam with a speculum exam at your gynecologist, and you may have this fear of coming into pelvic floor physical therapy that this is going to be painful as well. And it's not. Our pelvic floor assessments are done with one gloved digital finger. We are assessing the tissue very gently. We're looking to see if there are any trigger points, what your muscle guarding is. So that would be like a muscle spasm, a muscle contraction that doesn't really allow that tissue to stretch all the way to its full potential. We want to make sure that that tissue can contract when it's asked to squeeze, can relax when it's supposed to relax, but it shouldn't be uncomfortable. So this is where when we're doing the exam or your pelvic floor PT is doing the exam with you, you want to make sure that you're being upfront and honest with your provider and letting them know like, hey, that's a little uncomfortable, because it really shouldn't be. It shouldn't be painful. We want to be as gentle as possible because we don't want to inflict more pain upon you. Second thing is your grooming habits. You should really avoid stuff that's at the grocery store. Avoid that aisle with all those feminine washes and products. Your vagina is like a self-cleaning oven. You don't need to put smelly good roses and tulips down there, fragrance products, because they're not needed. Truly water, just splash some water up there to help freshen it up. You want to avoid putting any kind of body wash that you're using all on your body down in that area, because it can actually flare it up and cause a sensitivity down there, or cause it to change in color because it's aggravated tissue. So just water, ladies. You don't need to douche down there. Don't really need any of those feminine products, because the grocery store market is just really just wants your money, and you don't need that because it's a self-cleaning oven. So unless your provider has directly told you to use something, just use water. Second thing, since we're on the health of the vagina and self-cleaning oven, avoid using any tampons, pads that aren't free and clear. You want products that don't have any chlorine, that don't have chemicals, that are 100% organic cotton or 100% cotton, and anything that has the fragrance in it you want to avoid, because you don't need to smell like roses again down there, especially when you're on your cycle. You can just have something in there. It really isn't going to smell until it's taken out, and then the blood is mixed with the oxygen in the air. That's when you start having that odd smell, when it's in the trash and it's building up for a while. But you don't need that in your vagina. Keep your vajayjay happy with just using free and clear products. That's 1, 2, 3, 4. Oh, nothing's TMI. So when you come into our office, forget when you're like, I want to tell them something, but it might be a little bit too much information. Nothing is too much information. If you are thinking it, we've probably already heard it at least 5 times this week, right? We're all females. We all experience things, some people more than others. So for us as pelvic floor PTs to be able to help you to your fullest potential, we need to know all your information. So lay it out there. Don't be embarrassed. Please feel as comfortable as possible when you're opening up to us. That's what we're here for us to be able to help you with, for example, being able to orgasm again, or maybe you can only orgasm one way, or you have never had an orgasm. Be upfront and honest with us, and we can give you different ideas of planning out a roadmap of how to get there. That's what we're here for, to be your accountability partner, to be your coach, and to help you achieve your goals in pelvic health. Next one. Oh, coming in for your pelvic floor physical therapy session, you can be on your menstrual cycle. It doesn't bother us at all. There's so much that we can do without worrying or without even having to do an internal exam. We can help you externally with exercises, but it is okay. We wear gloves so we can double glove even if we're going to assess that tissue and try to get it to stretch out. Most often, if you're feeling kind of crampy and crummy when you're on your cycle, coming in for pelvic floor PT should help you feel better because we're helping that tissue to kind of calm down and relax. So completely up to you. Hope this helped you out. Please take these into consideration when scheduling your first pelvic floor physical therapy session. But these are just some tidbits we want you to know. And if you have any questions regarding them, send them in my inbox down low. Shoot me a message or a comment. I'll talk to you later.